Hi, so my name is Angela Flemmer. I work with the College of Nursing. I teach in the undergraduate and graduate programs. My course that I have been working on is NRSE 4551, which is a practicum course that goes along with NRSE 4550. And this is our second of three med-surg classes is what we call them. But this med-surg is focused on the older adult. And I am an adult geriatric specialist. I was trained in primary tissue and got my doctorate here in the care of the older adults. So I'm really hot about taking care of older adults. And one of the things that we know about this population is that caring for them doesn't just happen in the hospital. Caring for them happens in the home, in the community. And our goal is that we don't take care of them at the hospital because things don't go well when we do that. So, even before this QEP was introduced, after COVID, we had sort of shifted a lot of our focus in the clinical for this class in the hospital setting. And so the student was getting a really kind of one-sided approach to the care of this older adult. And so even before the QEP started, I had been sort of campaigning to make sure that we were getting all of the experiences in the community that we could get. So one of the things that, and we've been doing two of these things for several years now, but one of the things we do is we go to the community health center, which is one of our nurse managed clinics. We have 7 nurse managed clinics total, but we have the community health center as the place that we go for this course. And the goal of this was to get our students to see a well patient, right? Because they never, in the rest of the program, this experience is the only experience where they get to interact with a well patient. So the patient's there for their 3-month follow-up because they have diabetes and hypertension. They don't get this experience anywhere else. And it's really exciting to see our students come in with this kind of thought about what this environment's like. And then by the time we leave at the end of that day, they're so excited about outpatient care. I've had multiple students who have ended up doing their senior practicum in this environment based on this experience in 4th semester. So these students are an older student, they're 4th semester out of 5. So they're more experienced with things like vital signs, and they're very capable at this point of collecting a patient from the lobby, getting their weight, taking their vital signs, just checking them in and finding out why they're there. The goal of this experience is obviously, first of all, to see the well patient, get hands-on experience in this outpatient environment, and then learn about how we're doing disease and chronic management, because that is not also something that they get a lot of exposure to in the well person. These students do a experience paper and then a reflection after they have attended this day, and they often write in this, we had never thought about the continuum of care, because, and I'm in a kind of a unique experience because I'm also a nurse practitioner and I practice in our nurse managed clinics. So they see patients that are my patients that I'm taking care of, and they're just flabbergasted by the fact that patients get x-rays and pick up medicine from the pharmacy, and they do all of this work outside of this appointment that's required for their health, right? So they get to see pretty much the entire office. In this clinic, we have radiology, pharmacology, we have a lab, and we have like a outpatient pharmacy, and they get to see nursing care. So they get the whole gamut of the experience. It's really beneficial for them, and it's also beneficial for the community client because we're helping break up some of the workload, right? When we were there a couple of weeks ago with my group of students, we were able to help administer some vaccines to a difficult 4-year-old who wasn't super interested in receiving those vaccines. And so we were able to, instead of redirecting multiple staff from the clinic, we were able to take care of what the needs were for that client. So it's a really good experience. This is an older experience, and the initial community engaged learning experience that kind of got this course started But we also go to the senior center, which is over here on Bart Drive or Bart Street, I can't remember. But this educational project is a student prepared project where they create a trifold poster and a handout. And they go in, they create this handout about a comorbidity of the older adult that might be happening. We do talk about bone health, we talk about diabetes, we talk about hypertension, those kinds of things, and preventative stuff, education wise, that they can do to not end up either having that disease or having that disease worsen. So they create the trifold poster, and then they have a takeaway handout that they give away while we're there. And then finally, this is our newest project, the community client home safety assessment and health literacy educational intervention. It's a mouthful, but it's my personal baby, because I have drugged this from the depths of 2017 when I first started working here. We used to do this, and then because of COVID and things, we sort of went by the wayside. And I have been marching around with my sign saying, we are going to do this again, because home care is where it's at for the older adult. That's where they get their medicines mixed up. That's where they fall on their rugs. That's where all the bad things are happening. So we need to get the nurses into the home. So they go into the home, they do an assessment of that community dwelling. They look for concerns in the house. Or is there lighting? Is there a rug? Because I don't know if y'all know this, but every older adult has 18 throw rugs in their house. And they're always the big fuzzy ones, right? Yeah, it's a requirement. Like, you turn 65, you get manicures and throw rugs. I don't know, that's what they do. So we send them out, and they get to pick their community person. They go in pairs, but this assessment not only helps the older adult, like they get to see what's going on in their home that they need, but they also get some education from this nursing student. So the nursing student assesses what they need. They come back and they create this educational document. They say, okay, this is what's wrong with your house, and here's some information about how to fix that. And also here is some education about a disease process that you had a question about, something you had low health literacy about. So it's a two-level thing they get. This to me is this is our first semester redoing this since a long time ago, but in my opinion, it's one of the best things that we do as nurses, because we're reaching not one in place, but we're in everywhere. You know, some of our students are in North Carolina doing this visit. Some of our students are in West Virginia doing this visit. So we're branching out, not just in our local community, but in our surrounding communities. So it's been very exciting to get this back in place. And as of this week, Scott sent me the email, we are officially a CEL course, which is exciting. So we are going to continue to do this assignment. Obviously, it's a lot of back end on our part, legwork to get it set up, but it's been well worth it. So that's it.